Hey everyone, Dr. Luke Peterson here, physical therapist with the knee replacement therapist. For this video, I'm going to share with you 5 exercises that are common exercises that I'll give to people who are 12 weeks or 3 months out from knee replacement surgery. Just like with the video for individuals who are 8 weeks out, I want to present the caveats that 1, these exercises are not all inclusive. There's plenty of other exercises out there. These are just 5 of the ones that I like and find very helpful. Also, again, people may start these exercises earlier on in your rehab and recovery. Some people may not be able to tolerate and perform these exercises till later on in their rehab and recovery. But this is just roughly speaking around 12 weeks or 3 months, just a handful of the exercises that I like to give to my patients and clients. As always, I want to give you a quick reminder that if you like these videos, be sure to hit that notification or hit that subscribe button and turn on the notifications so you can catch all of our videos. I upload every other day, everything related to knee replacement surgery, rehab, recovery, exercises, and everything else. Enjoy the videos. This exercise is body weight squats. So hopefully early on in your rehab you start to do some sort of squat type motion. Maybe it's just doing sit to stands, so doing up and down from a chair, maybe with your arms crossed, something like that. But hopefully at some point you can progress to doing squats just using your body weight. So the easiest way to do it early on is having something sturdy that you can hold on to. I would say something much sturdier than this, but I'm just using this for demonstration purposes, the chair. But if you have your kitchen counter or the kitchen sink is really what I find is the easiest for people to use. And you're just going to get in the position like you would do a squat. So feet about shoulder width apart, toes pointing forward or maybe a little bit out to the side. And you're just going to come down as far as you feel comfortable and then back up. Down and back up. You'll notice if you're at the kitchen sink, you can kind of use your arms for some leverage and some stability, and that will help you maybe go a little bit lower in the squat. Same idea as if you used TRX cables, something that just lets you kind of sit back into the squat a little bit more. I can't really do it with this chair because it's going to fall away on me, but holding onto that thing in front of you and sitting down into that squat and then coming back up. Remember, keeping a good neutral, relatively neutral position of the back. We don't want to crouch and flex too much. We want to do that hip hinge type movement just like we do with the deadlift, coming up and down. Doing 10-15 repetitions. If you get pretty comfortable doing that with the upper body support of the sink, or you can wrap your arms around a pole, I've seen that before. If you get comfortable with that, then you can add some weight. So the easiest way I found, if you're not someone who has a lot of experience with weight training or squats, is just taking a dumbbell or a kettlebell or whatever you want to use as your weight and holding it in front of you like this, like a goblet squat is what we call this. And then again, keeping the legs a little more than shoulder width apart, squatting down and coming back up. Squatting down and coming back up. Go as far as you feel comfortable, as far as you can tolerate. You don't have to be perfect with it. You're still going to get a lot of tremendous benefits with strengthening whole body type of exercise. Hey everyone, this exercise is step downs. Also, I'll show lateral step downs. What you want to do is with a step, so I have an exercise step like this, but you can use just the steps you have on your staircase, kind of the bottom step. And you're going to stand. So first we'll just show you forward step downs or just regular step downs. So you're going to stand up on the step and you're going to have just the one leg come down and you're going to tap your heel and come back up. I like to put my hands on my hips to kind of give me that cue of keeping my hips as level as possible. You don't want it to bend too much. You don't want to bend at your trunk too much. Just coming down and then back up. Also, as you do it, you don't want to curl your spine. You want to keep a relatively neutral spine using that hip hinge strategy. Also, the other thing is with your knee and your leg, try not to let the knee cave in. Keep a good alignment, the knees kind of tracking with the foot, and then back up. This is a really challenging exercise, so start at the kind of the lowest level of the step that you possibly can. Another thing is hold on to that railing, hold on to the wall, whatever you have available. In this case, I have the exercise step, so I'm just going to hold on to the walker as I do it. And just get comfortable with bending that knee, coming down that eccentric motion, we call it, going against gravity eccentrically. And then the lateral step downs, similar, but you're now on the side of the step. So if you're on a staircase, you might go on the front like this. And same idea, it might even be a little easier to start with this one, trying to come down, tap the heel, and come back up. And you can see, even for me, I tend to have a little bit of an alignment concern with my knee. So this is a challenging exercise, so it takes a lot of practice. Again, if it's more tolerable and comfortable, hold on to the railing, hold on to the walker, whatever you have, the wall, to help with some stability as you do this exercise. That's forward and lateral step downs. This exercise is lunges, or more, a better name would be partial lunges. So again, holding on to something for support and stability. I'm going to use the walker in this one, but you can use, again, holding on to that kitchen counter, that kitchen sink, whatever you have available, tabletop, to provide some stability. You're going to have the one leg back, kind of on the ball of your foot. The heel can be up in the air. And all you're going to do, trying to keep a relatively straight back, is you're going to come down and then back up. Go as far as you feel comfortable. You don't have to go all the way and touch the ground by any means. Doing a nice partial lunge halfway, a quarter of the way, you're still going to get some great strengthening and range of motion benefits. Again, try not to lean forward as you do it, which is something I tend to do. You want to keep your back relatively straight and just come straight down with the knee, and then back up. Be sure to do repetitions on both sides to maintain good strength and mobility on both legs. This exercise is side steps or lateral walks. I like to use a TheraBand loop to add some resistance to this exercise. It's a great exercise for strengthening the hip muscles. You'll really feel it in the lateral hips and your glutes. And all you're going to do is you want to get into kind of a little bit of a bend in the knees and the hips, kind of what I like to call an athletic position a little bit. And you're just going to step side to side. A couple things to keep in mind is we don't want to do this. Some people will try to compensate and they'll bend their trunk like this, or they'll take these crazy wild steps. We want to keep everything nice and compact in this small, good alignment. So little bend in the hips and the knees, and we're just taking these little small steps. Make sure you're controlling this leg, the back leg. Don't let it fling into the other side. We want everything small, under control. If you don't feel comfortable with the band initially, try it without the band and the resistance, and then add it on. Up higher to the knees is going to be easier. Lower down at the ankles is going to make that resistance a little bit more. And that's banded side steps or lateral walks. This exercise is single leg deadlift. This exercise is really challenging for your mobility and your balance and coordination. I honestly am not great at it myself, and I never had a knee replacement or anything else, so this is really a challenging exercise. So it takes a lot of practice, takes a lot of getting used to. Recommend doing it with a therapist, practicing it if you're something you're interested in. So basically with a single leg deadlift, what you're going to do is you can have a weight in your hand like me. Sometimes you'll see people with a weight in both hands, or you can just do one side. I like to do the side opposite the leg that's going to be going in the air, but I have seen it with the same side as well. Basically what you're going to do, you're going to have one leg is going to be your stance leg. I like to start, especially early on, with just a tiny little bend in the knee, not keeping it perfectly straight or locked in. A little bit of bend, and then your goal is with that hip hinge technique, so trying to keep a relatively straight posture, straight spine. You're going to do one leg, this leg is going to come up behind you, and then you're going to hinge forward and then come back up. Now people with really good mobility and really good balance, they can go all the way down to the floor and keep a good spine. As I get down lower, I tend to start to round my back and flex. Just I have something I have to work on, and I really have to practice this exercise. But early on, go with what you're comfortable with. I'd rather you do it with really good technique and not go too far than try to go super far and get sloppy with the exercise. So you're just bending, trying to keep that hip hinge, that neutral spine, and then come back up. Again, this is a really challenging exercise for strength, stability, coordination, a lot of different things in play. So it takes a lot of practice, but really is an awesome exercise to do once you get the hang of it and get the idea of it.